Day-old chick quality. Producing good quality day-old chick begin with the breeder flock. The quality of the egg, health, and nutritional status of the breeder significantly influence chick quality. Difference in chick quality often arise from genetic background, nutrition, and disease status of breeder. Major factor affecting chick quality. Chick quality can be divided into two main categories: egg-related factor and hatchery brooding management factors. Considering the egg-related factor, egg quality, clean, intact shell prevent bacterial contamination. Contaminated eggs, especially with gas-forming bacteria, can explode during incubation. The proper sanitation and handling are essential. Breeder age. Young breeder produce smaller eggs. Chicks with lower reserve and higher susceptibility to brooding stress. Older breeder, large eggs and stronger chicks, but possibly lower hatchability. Breeder health status. Maternal antibodies are transferring via the eggs. A comprehensive vaccination program is required to ensure immunity against regional disease. Nutrition. Adequate balance of protein, energy, vitamin, and essential fatty acid ensure normal embryo development. Deficiency can cause poor hatchability or developmental deformities. Hatchery and brooding management factors. These factors affect the incubation, hatching, and post-hatch handling stages. Incubation environment. Incubation transform a fertilized egg into a chick under controlled conditions. Temperature. The most critical factors embryo metabolism depend on internal egg temperature. Optimal about 37.5 C. Too high, deformities or early death. Too low, delayed hatching and weak chicks. Relative humidity, controlled water loss, and air cell formation. Inadequate humidity, improper air cell size. Chicks may fail to pipe or hatch. Ventilation supplies oxygen and remove carbon dioxide. Poor ventilation, embryo asphyxiation or poor chick vitality. Egg turning prevent adhesion of embryo membrane and promote normal development. Eggs must be turned at least 4 to 6 times per day during incubation. Hatching and processing. During the last 3 days, eggs move to hatchers for the final stage. Hatching time varies. Some chicks may emerge 36 hours apart. Overheating hatch chicks cause dehydration and weakness. Post-hatch handling, sorting, vaccination, transport should minimize stress and delay before placement. Chick quality assessment parameters. Chick length, indicator of good quality chicks. More than 20 centimeter varies by breeds. Average weight about 67% of the egg weight. Activity and movability. Active, alert, upright posture. Navel, clean, dry, closed navel. Yolk absorption, complete. Abdomen firm. Livability, high survival within first week. In summary, high quality chick originate from healthy, well-fed breeder, clean, well-handled eggs, precisely controlled incubation and hatching, gentle handling and time placement, maximize livability, uniformity, and performance in the grow-out stage. Quizzes for your understanding. Which factors has the greatest influence on embryo metabolism during incubation? Egg color, relative humidity, temperature, shell thickness, temperature. Young breeder flocks typically produce larger eggs and strong chicks, smaller eggs and more fragile chicks, eggs with thicker shells, chick resistant to brooding stress. The answer is smaller eggs and more fragile chicks. Poor ventilation during incubation may lead to increased hatch rate, chick dehydration, embryo asphyxiation, better yolk absorption. Embryo asphyxiation. Why is egg sanitation important? Prevent humidity loss, reduce bacterial contamination, increase egg size, improve egg turning, reduce bacterial contamination. Diagnosing poor chick quality. Suppose weak chicks and high first week mortality. Hatchery report a batch of day-old chicks with low activity, poor nipple hatching, navel healing, and 15% first week mortality. The eggs were from a 27-week-old breeder flock, and the incubation date showed temperature fluctuation between 36.8 centigrade and 38.3. Relative humidity was not consistent monitoring. Discuss this question. What breeder-related factors might have contributed to poor chick quality? Maybe young breeder age and possible inadequate nutrient reserve, which incubation factor like worsen the outcome, temperature fluctuation and poor humidity control. What corrective measure should the hatchery take? Ensure stable temperature, monitor humidity to maintain proper air cell development, provide breeder nutrition optimization, improve egg handling and sanitation. How could chick quality be improved in the next batch? Better breeder management and vaccination, calibration of incubator sensors, reduce time between hatching and placement.